If you're just joining us, a very good afternoon. You're watching the afternoon edition of Newsfeed. Let's continue here. The South African Medical Association says it is aware of a circular issued by the Department of Health in Limpopo on the implementation of a standardized shift roster. The circular is set to be implemented from Monday. Now, the Medical Association is challenging the validity of the circular and does not condone its implementation. Now, it amounts to a unilateral change of the conditions of employment with a lack of any prior consultation and negotiations with those affected. SAMA has invited members from other provinces to send them queries relating to the conditions of employment. Let's speak now to Dr. Angelique Coetzee, the chairperson of the South African Medical Association. Dr. Coetzee, good afternoon and thank you for joining us this afternoon. Now, for too many workers, unhealthy work environments are prevalent, and the working conditions of health workers has also come under sharp focus, especially during the battle against COVID-19. Firstly, assist us by taking us through what the circular stipulates.
Good afternoon to all your viewers out there. Yeah, this is a very interesting circular. If they're going to try to implement this circular, I think they will run into problems because they have changed it into 3 12-hour shifts per week, including a 1-hour meal, and then one 7-hour shift per week. And they see a week, and listen, this is their definition of what a week is. A week starts on a Sunday morning at 1 minute past 12 and will then end on the next week on the Saturday at 12 o'clock at night. So, you know, a normal week starts in the 7 o'clock in the morning, and a 12-hour shift will end 7 o'clock at night, but not according to the Limpopo circular. So the shift system again will start from 7 o'clock to 9 o'clock, or 1900 hours to 700 hours, and 700 hours to 1500 hours for the 7-hour week. The 12-hour, as I've now just said, so if you look at how they implement it, I can only see chaos in that type of system. So there's no day or night on a roster anymore. So you get your 12-hour shift 3 days a week, and then you get a 1 7-hour shift 3 days a week, 1 day a week. So in total, you will work 40 hours a week. And then your lunch will be included in a 12-hour or a 7-hour. You cannot really work like that. There's a lot of studies that's been done that show that if you are on a night roster, you stay on a night roster. If you are on a day roster, you stay on a day roster. We need as doctors need to take decisions on a daily basis. So if you are working a 12-hour shift, and because there's also provision made for a 24-hour shift. So if you may work longer than 12 hours, your concentration goes. You are not as sharp as that you're supposed to be. Your litigation rate will go up. And on top of it, you know, if you look at the emotional stress that a lot of the doctors is currently experiencing, you will actually increase the emotional stress with these type of work hours. And since when is doctors being made shift workers? Never been shift workers before, and now there has nurses been shift workers before. So this is a whole new definition of working hours as per the definition of the Department of Health of Limpopo. That's not the standardized definition of working hours. And it seems to us as well that this is a poorly thought document. And this document is not speaking to specific specialities, but it's just a general document that's been sent out. It's not directed at either doctors, either nurses.
Let's speak about this document. Have you been able to validate whether the circular is indeed authentic and if it is issued by the Provincial Health Department in Limpopo?
Well, someone wrote a letter to the health department and asking them to retract this circular, and they did answer us back and said they're not going to retract it. So we'll also put them on terms, and then if they don't come back with an answer to us, we will also proceed to the court, because this is unacceptable. You cannot, it is as it seems Limpopo wants to lead, in the country. They're talking about their HR plan. They're doing this in according to their HR plan. Can we please see that HR plan? So where is that plan? And if that is their HR plan, it makes no rational sense. Can you imagine starting to do a roster where you now need to get doctors and nurses on 3 12-hour shifts and 1 7-hour shift, regardless day or night? You now need to start working that out. You need to keep in mind that there's clinics that needs to be run, there's outpatients on a daily basis, there's emergency services. How are you going to be able to do this? Very poorly thought plan. I'm sorry, this is not a very, very good plan. And on top of it, it has not been discussed with the relevant role players. There was no discussion that we are aware of with the trade union or labor organizations, with SAMA, and therefore we're not in favor of this. It has not been discussed.
All right. So you speak about your intention.
You cannot just bring it to us.
You speak about your intention to challenge this circular. At this point, have you made any legal representation?
Yes, we did. We did send them a legal letter.
And
as I have already indicated, they answered us, not going to retract, and then we put them on terms, and we are now waiting for their feedback on that. Otherwise, we will go further. This circular is a nonsensical circular. It doesn't make any sense.
All right. And before I let you go, I also want to pick your brain or just get your initial response regarding the latest batch of Johnson & Johnson vaccines that landed in the country earlier on this morning. What has been the reaction from your organization?
Well, we're happy to see that at least the second batch is coming in. And we would like, again, to urge all our members and other healthcare workers, please, there will be enough vaccines coming in to vaccinate the current healthcare workers that has been registered on the system. For those of you who has not been registered yet, please go and register. We know it's not going to prevent you from getting COVID-19, but at least we know that it will prevent you from getting serious disease. And that is the purpose. So we don't want you to die. We don't want you to end up in a hospital, especially now if you're going to get doctors doing shift working in certain provinces. It's going to be a nightmare.
All right. And we also heard from the health minister a bit earlier on in the week expressing, well, at the time that about more than 50,000 medical practitioners or medical healthcare workers had also been vaccinated through this Johnson & Johnson scheme. What's the response that you're getting from your members? Are they keen on getting vaccinated, or are you also getting a sense of apprehension?
No, they're very keen. They're extremely keen, and it happened, in such a way that they are actually angry if they can't get vaccinated. So the response is just overwhelming from the doctors and specialists side, and as well as the nursing and other allies. So if you look at the appetite for being wanted to be vaccinated, it is just amazing, So we are extremely happy that this vaccination program rollout that is currently under a phase 3B project or plan will at least protect our members, as I've already said. And if I say our members, I'm just speaking in general. Whether you are a SAMA member or not, it will still protect you. So please, again, we are very excited with this, and we urge everyone, please be part of this.
But have you noted any concerns, especially with the registration system that government has put in place for medical workers to get registered to get the jab?
Yes, that's for sure there. Yeah, those hiccups is there, but I must say after last weekend, especially in Pretoria and in Cape Town, a lot of effort has been made now to get this rolled out in a much better way. We have learned a lot of lessons. And yes, the EVD system is still has its hiccups, but at least we have learned. This time I can say we have learned. In 1 week, we have learned a lot of lessons, much better than we have learned between the first and second wave. So yes, the process there's still room for improvement. Lots of improvements can be done, but for now, at least we get the ball is rolling. Even today, there was no complaints from Steve Biko, academic hospital that I received. During the week, the members also went for vaccination. Good response from Baragwanath Hospital, good response from the Cape Western. Still a bit of a trouble with KwaZulu-Natal, and we are a bit worried that Limpopo, Mpumalanga on the private sector, there's not a huge uptake. Not sure what is happening there, but for the bigger centers, yes, there's a good uptake, and yes, we are learning as we go.
And as we wrap up, I just want to find out from you if you've received your jab, and if so, what has been your initial response or reaction to this? Or just what are you hearing from your colleagues as well? Are there any side effects to this vaccine?
From my colleagues, the only, a bit of a sore arm and nothing more. We haven't heard any adverse reactions from the doctors yet. No, nothing came to the MAC on Vaccines Committee as well. Nothing to alert us, but remember this is going to be for the next 6 months, there would be a close eye on all these doctors and nurses and other healthcare workers who receive this jab. So this is, there's a good program put in place. And for myself, I've got antibodies. I don't know how and where I got it. So with all the drama, I had my voucher for last week Sunday, and with all the drama that Steve Biko, I said, okay, I will wait. And as I still have my antibodies, so in the next 2 or 3 weeks, I will get my jab. And I would be very, very happy if I, to also go through this experience. For now, I'm still safe.
Well, Doctor, thank you very much for your time. That was SAMA Chairperson, Dr. Angelique Coetzee, speaking to us about the situation playing out in Limpopo and also adding a voice to the rollout of vaccines in South Africa. Well, still to come, residents